thank you, everybody. A very good evening to all of you. I am Rima Bose-Suri, and I am Chief Customer Officer for Elders India. And I'm delighted to have you all here today evening for this session, which we are bringing to you in collaboration with the Global Prostate Cancer Foundation. We will be sharing a little bit about them. And thank you to Colonel Ayappa and the team who is also with us here today. So just before we move ahead, a little bit about Elders India. So we are a unique venture, and we're attempting to build an ecosystem of support for all our elders in our society in India. Elders India is actually a B2B2C initiative where the employees of the corporates that tie up with us can avail of various services on our platform for their elders. And our platform gives them the benefit of choice. It gives them a choice of partners. It gives them a choice of understanding what are the kind of resources which are available in different parts of our country, which can help them and help their parents and grandparents to lead a comfortable and independent life. So as part of our initiatives, we have been running a series of awareness initiatives, which is delving into different aspects of elder care needs. We recently concluded with the Global Alzheimer's Month, and we hosted a series of initiatives to help people understand more in detail about Alzheimer's. Today's session is on prostate cancer, which is again something which is known about, not talked about enough. And we're delighted that Global Prostate Cancer Foundation is doing a lot of work in the area of spreading awareness. I'm now going to hand over to K.S. Raghunathan, who is the founder and CEO of Elders India. And this whole initiative is his baby, to welcome everybody and take the session ahead. Over to you, Raghu.
Thank you, Rima. Good afternoon, everyone, and welcome you all to this webinar. And thank you all for joining us. As Rima mentioned, continuing with our series of awareness webinars, today we focus on getting a better understanding on prostate cancer, one of the most common type of cancers amongst men. I will try to understand what is it, how do we diagnose, what are the risk factors, how can we prevent, what are the treatment options, and also get to hear a little bit on the experience and perspective of a survivor as well. And we are privileged to have Dr. Raghunath, Dr. Ravi, and Colonel Ayappa with us today. Dr. Raghunath might get slightly delayed. He's in an OT, I understand. And as you can see, Dr. Ravi has come from a OT right now. And but we're really privileged to have them to enlighten us on this topic. Thank you, doctors, and welcome again to the webinar, all of you. I'll just briefly mention and give an introduction on the doctors. Dr. Raghunath SK is a senior uro-oncologist. He is the director, urologic oncology and robotic surgery at Trustwell Hospital and HCG Cancer Hospital, Bangalore. And Dr. Ravi is a consultant uro-oncology and robotic surgery at HCG Hospital, Bangalore, and has been awarded USI Traveling Fellowship to American Urological Association and Nepal Association of Urology as well. Colonel Ayappa is a veteran engineer with over 30 years of experience, an outstanding sportsman, represented India in hockey, and keenly involved in the development of sports in official and personal capacity. And he is the founding trustee of Global Prostate Cancer Foundation India today, and he is the prostate cancer survivor as well. He'll give us a perspective from a survivor standpoint and also give an introduction on the work that the foundation is doing. We'll first begin with the doctors. Dr. Ravi, over to you. And once you give a quick overview, post which we'll have Colonel Ayappa come in and give his perspective. And after which we'll be, taking some questions and continuing this program. Over to you, Dr. Ravi.
Yeah, just I'll share my screen. I hope you're able to see my screen.
Yes, we can see, we can see.
Yes, Dr. Ravi. Thank you.
Yeah, so thank you, Elders India and the team from Global Prostate Cancer Foundation for having me. And today's session, I would like to educate you all about prostate cancer. So I would be highlighting all the points which are mentioned on the screen one by one. So I would start with what is cancer actually. Before diving deep into prostate cancer, we should have some idea about what is cancer. So cancer, as you can see on the screen, there are normal cells and cancer cells. So you can see the orderly arrangement of the normal cells in our body. So these are the cells which do their function, grow and die off. But these abnormal cells, they have some changes. They don't die, they multiply and they can invade other parts of the body, as you can see in this picture. So this is what is cancer on the basic front. Now, what causes this cancer? So the moot point here being, there is some sort of genetic change that is happening in our cells. If we go back to biology, our cells have a nucleus. So the nucleus contains the genetic material which is the blueprint of our life. So somewhere there is a genetic change that happens and which allows the cells to autonomously grow and divide uncontrollably and invade other parts of the body. So what causes these genetic changes? So there are multiple causes. So it could be hereditary. It could be there, your genetic changes could be there in your family members, which could be passed on to you. It could be exposure to ultraviolet rays, some chemicals in the industries, pollution. There are some viruses which can lead to genetic changes. Smoking, as you all know, is the biggest cause of cancer. And sometimes we don't have any reason, and just the dividing cells, while they are dividing, can develop cancer. So before diving into prostate cancer, where is the prostate exactly in the male body? We should answer this question first. It lies deep into the pelvis, as if you can follow my pointer, it's there inside the pelvis. It lies just behind our pubic bone. It is below the urinary bladder. This is the urinary bladder, and it lies just in front of the rectum. This is the part from where all the feces come. This is the urinary pathway. So this is the penis, base of penis. So it just lies above the base of the penis and below the bladder. You can see the urine pipe that is called the urethra, which it comes through the prostate and the urine comes out through this channel outside. So you can look at it more closely now. So this being the prostate, it's a walnut shaped gland about 25 grams in size. And the urine from the bladder comes out from here, it traverses the prostate. This is another view of it. So this tiny organ in our body can also develop cancer. So what are the risk factors for developing prostate cancer? So the first major risk factor is age. Age is not in our hands. So as we age, the risk of this prostate cancer rises. So above the age of 50, generally we come across prostate cancer, and about 60% of all our prostate cancers actually are diagnosed after the age of 65. Certain races, human races, are more prone to have this cancer. Probably the African races, African ancestry, the black population in America are more prone for this. And another important point is the family history. So we share the same genes with our family members, our fathers or forefathers, and we also share environmental and lifestyle factors along with them. So any first degree relative, meaning parent, sibling, or a child, has 2 to 3 times higher risk of developing these cancers. Of course, diet has been implicated for prostate cancer prevention also, like lycopene, soya beans, and tomatoes, but nothing has been proved. So actually, there is no preventive dietary measure or something in diet that causes prostate cancer. Nothing has been proven uh, beyond question till now. So next comes the most important part of this talk, why we should screen. So as you can see, this is the age-adjusted risk of prostate cancer incidence and mortality. So you can see in the North American, North European and the American population, the incidence of prostate cancer is quite high. You can see here in this graphic. And you can also see the mortality rate. We are down here, South Central Asia. So India is part of South Central Asia. You can see the incidence. You must be thinking the incidence in India is very less. But the most important point here is these countries, which are the Western countries, they have a very good screening program in place. So they catch their cancers early, they treat them, and if you see the incidence to mortality rate, their mortality is not as high as their incidence when you compare it to South Central Asia. So even though our incidence is high, our mortality compared to the incidence is also high. It's almost 50%. So this is another graphic showing that in 2020, this is a Globocon data showing only 34,540 patients diagnosed with prostate cancer in India. But I think this is not the case. This is tip of the iceberg. We don't screen, so we don't detect cancers. So that is why detection is very important. So next comes why we should screen. So screening is actually done before the symptoms and signs of any disease arise. So when we catch cancer at an earlier stage, meaning without symptoms and signs, then we have a better chance of successfully treating it and probably curing it as well. So in turn, lower number of people die of cancer. So that is the moot point of screening, that you should catch the disease early without any signs and symptoms so that we can treat an early cancer which is potentially curable and lot less people die of it. So next comes, when do we screen for prostate cancer? So these are the 4 points I would like to highlight. So men from the age of 50 years onwards, all men, irrespective of their race, of where they belong, and all men from the age of 50 should be screened. Men with family history of prostate cancer in their brothers, probably in their family, in uncles or fathers, they have to be screened earlier, probably from 45 years of age. People with African descent also have to be screened earlier, around 45 years. And some men who have known genetic abnormalities diagnosed earlier, they should be screened even earlier. By the age of 40, they should start screening them for prostate cancer. So next comes the important point of how to screen this disease. As I've already shown in my slide earlier, the prostate lies deep into the pelvis and just in front of the rectum. So we can easily, as doctors, go and examine the prostate through the rectal opening with our fingers, gloved fingers, of course, and feel for the prostatic contour. This is called a digital rectal examination. So we can detect with our fingertips any abnormality in the prostate contour, any hardness, any textural change easily. So this forms one part of the screening. But to be really sure, whether we are dealing with prostate cancer or not, because there are multiple reasons for the gland to be abnormal. Yes, prostate cancer being the most important reason, but we can do a simple blood test, which is a serum PSA test. PSA is prostate specific antigen, and it can be easily done in our labs anywhere. Now it is very commonly done, and most labs would do it. It's very cheap, around 400 to 500 rupees to screen for this prostate. So any abnormal rise in PSA can uh, set an alarm, and you have to visit your doctor, probably a urologist or a uro-oncologist, to know further. This is not a diagnostic test. So even if your digital rectal examination is abnormal and serum PSA is high, it indicates of cancer. These are not diagnostic. We will require certain other sophisticated tests to further do analysis and come out with the diagnosis of prostate cancer. So this being the MP-MRI, you can see the MRI machine. So if your doctor has a suspicion of prostate cancer and you have an abnormal DRE or abnormal PSA raised, your doctor can advise you for further tests. MRI, which localizes the disease in the prostate in and around. And this is what is called the biopsy. So we take tissue samples from the prostate with a small USG ultrasound guided needle, which collects cores from the samples from the prostate, and we can send this for analysis in the pathology lab. So this gives the confirmation of prostate cancer being there. Of course, this is a advanced PSMA PET scan, which looks at the whole body from head to toe for any other signs or spread of cancer. So this comes later on in the algorithm. But going back, digital rectal examination is a very easy, simple examination. We can look for changes in the prostate, but many a times you can see this finger. It may not be able to feel the prostate over here or cancer in this part because your finger cannot reach there. Sometimes early prostate cancers won't come up to the part where your finger is palpating. So does not mean that a normal prostate examination, digital examination, may not harbor any cancer. That is why, to supplement it, we have this blood marker. I hope you understand this. So next comes the symptoms of prostatic disease. So as you can see, the urine from the bladder goes into the urethra, and this is the prostate. It goes through the prostate. So as we age, unfortunately, in men, the prostate enlarges with age. This can be a normal enlargement. Enlargement can be because of cancer. We don't know. So as you can see, as this prostate enlarges, the urinary path over here, it gets compressed, and then we develop symptoms, which I'll show you in this slide. So we have difficulty in urination, low frequency of, low stream of urine. You have to strain while urine. There is frequent urination during the night time, where you get up and go to the bathroom often and probably disturb your sleep. There is a constant urge to urinate, and you find it difficult to hold on, and probably there is some leak of urine also. These are some alarming symptoms. Sometimes you might find blood in your urine. Swollen limbs and back pain, although they are not very diagnostic of prostate cancer, but some advanced diseases can have this. So apart from the symptoms that I've highlighted earlier, these symptoms are actually not diagnostic of cancer. Any gland which enlarges, either normally or abnormally, can present with all these symptoms. So doesn't mean that if you have all these symptoms or one of these symptoms, you have prostate cancer. It just means that you have an enlarged prostate, which needs to be looked at by your urologist or uro-oncologist, and they would come up with the diagnosis of prostate cancer in those people. Certain other symptoms might be there if people neglect these symptoms, and if god forbid you have prostate cancer, it might progress to develop some of these symptoms like pain, bony pains, there is swelling in your feet, unexplained weight loss, fatigue, and change in bowel habits. These are all signs of advanced disease. But the point I want to highlight is we should not wait for these symptoms to arise to visit our doctors. I would like to highlight that by the age of 50, all men, irrespective whether they have symptoms or not, they need to go for screening tests, which can be done with a simple PSA test, blood test. So next comes the staging of prostate cancer. As you know, prostate lies deep in our pelvis, and these are the pictorial representations of the stages of cancer. There are totally 4 stages. Stage 1 and 2, you can see this cancer focus in the prostate gland. It is within the gland and it is a small focus. This is a stage 2. The size of the carcinoma or the tumor is increased, but it still lies within the prostate. In stage 3, it spreads outside the prostate, breaching the capsule of the prostate and going into the surrounding organs like seminal vesicles, the bladder base over here, and other areas probably in the bone and rectum. This is stage 3 or locally advanced disease. And in stage 4, of course, it can go even further out into your lymph nodes and into the rest of the body. So this is the basic staging. The stage 1 and stage 2 cancers are potentially curable, and I will show you the treatment algorithms in brief in the next slide. So as I told you, localized prostate cancer, which is stage 1 and stage 2 cancer, there are 3 treatment options for this. The major options being the surgery and radiotherapy. Even small focus of cancers can be actively surveilled. This actually, prostate cancer is a disease of the elderly. So sometimes prostate cancer can be slow growing, and very small focus of cancer might not require surgery or radiotherapy as well. It could be just kept under surveillance, and when it starts growing, we can switch to surgery or radiotherapy. But this is for localized prostate cancer, stage 1 and 2. Active surveillance is stage 1, very early disease. You can go for active surveillance as well. Caveat being your doctor has to see all the risk factors. Otherwise, all localized prostate cancers are amenable for surgical treatment as well as radiotherapy. And this gives potential cure. So localized stage 1 and stage 2 cancer are potentially curable. Symptoms of this cancer may or may not arise. So don't wait for symptoms. If your symptoms come, maybe you are not a localized disease, you are locally advanced, where it is a multimodality treatment. You need surgery, you probably might require radiotherapy at some stage, and hormonal therapy. Now, what is this hormonal therapy? Hormone therapy is like in males, testosterone is the major hormone, and it is the fuel for prostate cancer. So when you cut off the hormone, like testosterone, suppress it, the cancer shrinks, the gland shrinks, and this can provide some control to some extent. But it is not to be used in singularity. It comes with surgery or radiotherapy together. And this is advanced or metastatic prostate cancer. this is stage 4 cancer, which has spread metastatic cancer, meaning it has gone outside the pelvis in the bones or probably lung and all those areas distant from the prostate, where you need chemotherapy. And nowadays, very specific targeted therapies are also available for these cancers. So these form just the outline of the treatment options that we have for all the stages of cancer. Of course, I'm a robotic surgeon. So as you can see in this photo, the surgeon sitting on the console and the two assistants helping out the surgeon with the surgery, and the patient lying on the operating table. Of course, the surgeon is controlling the robo, and there are certain advantages with robotic surgery, it being minimally invasive, of course, but the incision is smaller, the blood loss is less, the recovery times are very less. Probably next day, this person on the operating table will be able to walk, and in 1 or 2 days later, he might be discharged. So nowadays, if surgery has moved from open surgery to robotic surgery, and we at HCG are doing this. Thank you. I would be happy to take any questions after Dr. Karnal Ayappa has spoken.
Thank you, Dr. Ravi. And Kanal Ayappa, would you like to give us a perspective of this disease from a survivor standpoint, as well as give a brief overview of the work that the foundation is doing? Kanal, you're on mute.
Channel Ayappa, are you able to hear us? Raghu, would you like to just start with a question, Dr. Ravi?
Looks like Kanal Ayappa may be having some technical difficulties. Thank you, Dr. Ravi, for a very detailed overview. No, the good thing about what you mentioned was that the survey. Are you able to hear me?
Yeah.
Yes.
I think Kanal Ayappa is back.
Hello,
Kanal,
can you hear me?
we can hear you. We cannot see you yet.
Your camera has got switched off, Colonel.
Just a minute. Yes.
Yes, Colonel.
Can
Over
you
to
see
you.
me?
Thank you, sir. Yes, we can see you.
Thank you, Raghunandan and Rima, for arranging this webinar. As you said, cancer is a disease where people show a stigma towards it. We need to overcome that. We need to treat that, and we should not lose people's life due to this cancer. I am a prostate cancer survivor, and when I was diagnosed with prostate cancer, I was devastated, and now I was looking for what to do next. I landed up with Dr. Raghunath, and he has treated me. So in 4 days, I was out of hospital, but there were questions in my mind. Why there is no awareness about this cancer among men? All other cancer, they have seminars, they have what do you call it, advertisements, they're talking about various things. Otherwise also in common places, they discuss this cancer, that cancer, but no one used to speak about prostate cancer. And me and my wife used to talk about this. When we visited for my second review with Dr. Raghunath, my wife couldn't control herself. She asked doctor why there is no awareness programs, awareness activities with regard to prostate cancer. That question started this foundation. Dr. Raghunath came up, said, "Sir, can you help us out? We'll do something." So then we registered this trust, a charitable one, to give awareness, to reach the person we don't know, but we want to help him. Because people do not know anything about it. I didn't have any symptoms whatsoever. So that is with that idea in our mind, we started this charitable trust with a very, very limited objectives. Provide awareness, detect it at early stages so that it is potentially curable, advise them for the treatment. Before that, you also counsel them. Because once someone comes to know that he has got cancer, he is devastated. The individual suffers in three ways. One is his physical discomforts, undergoing surgery, vagara vagara. Second is as I said, stigma and the psychological pressures. It is not only that you suffer that, your family and friends, they also suffer on this. Because society has not accepted it as it is. And third is the financial aspects. If you are in fourth stage, your expenditure for treatment goes beyond your imagination. So the counseling is very important. Then the treatment we suggest, we are not hospital centric. Wherever he is there, which is convenient to him, he can go to those hospitals and get himself treated. So this being so, once we registered and we had a concept in mind, we wanted to have few eminent personalities with us as the advisors. We have 2 lieutenant generals, 4 doctors, 5 engineers, 2 IPS officers, 1 IFS officer. So this forms our, and 1 IT guy. They all our, there is Vishwas Bopanna. He is also our advisor on IT to develop our website and other activities, IT activities. He's taking care of it and is advising also. So this being so, when I got my treatment done, I went through all these stages. Now I don't want person who is not known to me to undergo these stages. If we can avoid, why not? Can we do that? That is a question we need to answer. The answer is yes, we can try and avoid people going through these stages, these problems. That's why we are thankful to Rima and Raghu for providing us a stage and a platform from where we could come across to you people and tell what it is to undergo. Doctors, yes, they treat us, but the person who got treated knows how is it. So we have a team of medical doctors, a medical panel, and they're all supporting us. Dr. Ravi also is one of the members in our panel, medical panel. They're all super specialists. They're willing to support us in this cause. They've seen there is some, what do you call it, meet in this point where they're talking. We also have a management committee where they all support us in various activities of this foundation. Our idea is to reach out to at least 1 lakh of people in a calendar year. Though we started early, during 2019, because of the COVID, we couldn't do that. After COVID, now I'm happy to bring it out. We have touched over 13,000 plus people on awareness programs, and we have screened about 3,000 people for cancer detections. So this is what we do. We, at the end of the day, our aim plus is to establish a hospital, at least about 200 bedded hospital, where we can give the best of treatment at the cheapest possible rates. Again, I thank Rima Bose and Raghunandan for providing us this platform. Thank you so much.
Thank you, Colonel. Thank you, Colonel Ayappa. It's been it's a great story. Having been a survivor, having known that there is a little awareness initiative, you have taken up this particular initiative of forming the foundation, spreading the awareness along with the medical professionals, in this field. Thank you so much for your perspective as well. I was just remembering the chart that Dr. Ravi that you just showed, where the incidence in India is quite low, and it is not because the number of prostate cancer patients is low. It is just that they have not been screened.
Not screened.
And
We form more than 16 to 20% of world's population. It's hard to believe that there's such low incidence.
absolutely, and age being a key driver, as you mentioned, and the number of elders in India is increasing rapidly, and this is going to be a major concern if this is not getting addressed quickly. The question I had for you was, while it's good to know that the survival rates, even if it is diagnosed, as long as diagnosed early, is very high, and the treatment is also not very difficult. But what's of concern is, there are no visible symptoms, or nothing that the patient will feel, even if potentially the cancer has progressed to stage 2 or 3. So, in addition to our proactive screening that you suggested, is there anything that you can suggest in terms of prevention? What can we do to prevent?
Actually, there have been some drugs which have been used for prevention of cancer. But generally, that is not in common practice. It is equivocal results. So I would suggest the best way to stop or prevent this cancer might be to screen early. See, if we screen early, we detect early, we treat early, and survival is possible. Prostate cancer is a slow growing cancer. There are some other prostate cancers, the usual type, 95% prostate cancer is a slow growing cancer. So if we detect early in stage 1 and 2, probably that's why you don't get symptoms because it's slow growing. You don't know whether it is there or not. And as common people, it's right in asking whether we can prevent this cancer from coming. Yes, like for lung cancers and other cancers, you can uh, follow a healthy lifestyle, not smoke, not go heavy on alcohol, avoid pollution. We have not come up with a preventive strategy for prostate cancer as such. Like there is no single factor. That is why following a good lifestyle comes into play. See, there are many organs in our body, prostate being one of them. Now, there is no specific thing to follow for every organ of the body. So, in totality, what you can do is follow a good and healthy lifestyle, improve your diet, exercise, avoid pollution, plastics. There are some environmental exposures you need to avoid: smoking, tobacco use, uh, cut short on your alcohol. All these put together will stop most of the cancers which are environmentally driven. But if there are some genetic abnormalities prior in your family, you have no control over it. So the genetic makeup of your body sometimes might be such which would make you more prone. So for that, you have to just screen early and treat early. That's what I would like to say.
So, Dr. Ravi, to just build on that, now there is an aspect of hereditary also, and you mentioned certain factors which must be kept in mind. So, are there any additional precautions that for somebody who belongs to a family where there have been multiple cases of prostate cancer?
Yeah, so for them, as I told, if you have a family history of prostate cancer in your family, you need to get screening done by the age of 40. Because as of now, we cannot change your genetic makeup. There is research to do that, but it's not common, and we can't change your genetic makeup. So if you are prone to have prostate cancer in your family, it's best to screen early, detect early. So start your prostate screening by the age of 40. Yearly once you can do your PSA test. Uh, I would also like to highlight, if you do a PSA test, in the report they give a PSA of 0 to 4 being normal. But there is a catch to that. It all your PSA values also depend on your age. So somebody who is 40 years of age and if his PSA is 3, I would be a little concerned. He would require further analysis. So don't go by the report saying 0 to 4 being the normal level. Even a level of 2 or 3 at the age of 40, 45 needs to be looked at seriously, and you need to go to your doctor. So this is one thing that we can keep in mind.
Actually, Dr. Ravi, you mentioned about not relying too heavily on the PSA value. And my personal experience was when I got this test done a few years back, and the PSA levels were very high, and we were on the path to kind of do further investigation. But when we did a repeat of the test, it came well within the normal range.
Yeah.
Are the PSA
So as I
numbers
said,
not very reliable?
no, PSA is prostate specific antigen. It is not prostate cancer specific antigen.
Mhm.
There can be other reasons for your prostate, for your PSA to be risen. So
Mm.
cancer being the most dreaded diagnosis, so we try to rule that out. If you have a raised PSA, of course, we don't go by a single raised value of PSA. We do a PSA. If it is high and we are concerned, we get one more PSA probably a week later. just to confirm that it is high or rising. So we see the trends. What can be the other causes of raised PSA? Probably you have a urinary tract infection. Probably you have some stone in the prostatic urethra. Probably uh, you have a prostatic infection, uh, prostatitis. All these things can also increase your PSA. And one more thing to be kept in mind is sometimes when you are a little older, your gland will increase in size. That is normal for everybody. Even my prostate gland would increase in size. You would develop some urinary symptoms, some sort of, if you have noted, probably in the elders of your family, they would have some issues with urination. They have to strain, or their stream is not good, or they go frequently. Does not mean that they have prostate cancer. We do PSA and check. If there is any suspicion, we go for further testing to prove that it is prostate cancer. Does not mean that if your PSA is high, we go for a prostatectomy or we go for radiotherapy. We rely on MRI, we rely on the biopsy, and in totality, when we can prove that it is cancer, we go for the further treatment. So yes, PSA is prostate specific. It is not prostate cancer specific. So there are certain other factors which can raise your PSA. So the main
Got
point,
that.
if you have raised PSA, go to your doctor, get yourself checked. He will let you know. He'll be a better person to evaluate, and he will come out with the diagnosis. So the PSA being just a screening test. If you have raised PSA, go to your doctor. That's the meaning of that.
That's the meaning. Got that.
And
Colonel, sorry, go ahead. Go ahead.
someone has also asked, Mr. Ritvik has asked, does enlargement of the prostate means that it is likely to be prostate cancer, or does it lead to prostate cancer?
Enlargement can happen to normal people also. With age, the prostate enlarges. So you might develop some of the symptoms of urination, frequency, urgency, straining. Does not mean that you have cancer. It means that you need to be looked into, and we have to rule out cancer. There are, for the benign diseases, those are not cancers. We have other treatment for the prostate, probably a TURP, endoscopic resection of the prostate. So when the prostate enlarges, as I shown you in the slide, it will obstruct the urinary passage. It will become smaller. That's why your urinary problems arise. So if it is not cancer and it is a benign prostate, and if it is giving you trouble, there are ways and medications to tackle that. So we can start you off with some drugs, or we could do an endoscopic procedure to relieve your urinary symptoms. Does not mean that you have cancer, but you can benefit with these medications and endoscopic surgery as well for a benign prostate, non-cancerous prostate. Yeah.
Colonel, I have just one question for you as a survivor. So, post the treatment, have you been in a position to kind of lead a normal life? Do you see any impact of this disease post that successful treatment of yours?
You could say, yes, normal life, there's no issues at all. You can lead a normal life. And for your information, I think after 6 months of my surgery, there's a golf tournament which I participated in and won. So do you say that I'm leading a normal life?
Absolutely, it does suddenly appear so, and with all the energy you're showing and taking all these initiatives in your 70s, it's...
Raghunathan, one more point I wanted to add. Rima and her gang, ladies should not get disappointed. Ayappa is only looking after men. It so happened when we started this trust, as I said, we wanted to have few doctors as advisors. Dr. C. Ramachandra, Director of Kidwai Memorial Institute, that is generally known as Kidwai
Yeah.
Hospital for Cancer. He is one of our advisors. He come out and said, "Sir, you're doing this. I want your help." I said, "I'm a one-man army. You got an ocean of an organization. What help can I do for you?" He said, "That's not the thing. These days, teenage girls are also getting breast cancer. So the awareness about breast cancer needs to be brought out, and it'll have to be opened up among ladies also. So we have started breast cancer screening also, awareness programs also. So there is a Rima Bose. I hope you are happy that we do something for them also, ladies also.
Yeah, and one more point I would like to make is
Yes.
I told you about the family history.
Mhm.
So it's not just that the male have prostate cancer. Of course, they have the prostate cancer, but the females of the probably a person who has prostate cancer, he will in his sons have prostate cancer, but the daughters, actually his daughters can have breast cancer. Because they share similar genes, breast cancer and prostate cancer. So any history of prostate cancer in your fathers, the daughters need to be checked for the breast cancers earlier. Anyway, all women should get mammograms after the age of 40. By the age of 40, they should start getting mammograms. But those females who have a family history of prostate cancer, in their fathers, uncles, they should do that earlier, because sometimes you might harbor genes that could have been transferred and you could be prone for breast cancer.
That's a great warning and input, Dr. Ravi. And thank you, Colonel Ayappa, for doing what you're doing on the breast cancer as well. But Dr. Ravi, is the reverse also true? Let's say if there is someone, let's say your mother or somebody has a
Yes.
breast cancer, is it likely that the males in the chain will have?
BRCA, yeah, the BRCA gene is there. That is a
Uh-huh.
breast cancer associated gene.
Mhm.
So it is a common gene. So it causes breast and prostate cancer both, can
Okay.
cause. So it can lead to prostate and breast cancer. So if anybody is there who has a family history of prostate cancer, females of those families better get your mammograms early. Males from those families better get your PSAs early, by the age of 14 males,
Mhm.
earlier in females. Yeah.
I had one other question, Dr. Ravi, in terms of the propensity for certain set of people getting this more likely. For example, you said somebody with African descent is likely to get this earlier or more prevalent and so on. Within India, I hear that, let's say in Delhi, there is higher incidence and there is lesser incidence in Northeast or in Gujarat or so on. Is
Uh,
there anything genetic within the country that we see as well
uh,
in
our
terms of?
genetic makeup is slightly different from the West.
Mhm.
Our cancers are actually more aggressive cancers.
Mm.
Uh, and to tell you, prostate cancer is the second most diagnosed cancers in Pune, Bangalore, Delhi. So it is prevalent in India, and our cancers have some genetic makeup which is slightly different from the West. Our cancers can be a little more aggressive also. So I'm not scaring you, it's just for information. So that is also the reason why we should be treating cancers at earlier stage when they are potentially curable. Stage 1 and 2. Stage Late stage 3 and 4, You need multimodality treatment. The treatment can control cancer, may not be able to cure. If the treatment one arm fails, you need to progress to a different modality, chemotherapy, targeted therapy. All this have cost implications, lifestyle changes. Uh, so that's the point.
No, I got that. But within the country, is there any difference? Let's say between Delhi and Northeast, and I understand Northeast is very, very low. Gujarat is low. Is it just a question of screening, or is
It's just a question of screening.
something more? Okay.
I can speak about the urban population because we have not penetrated enough into the rural part with the genetic analysis.
Mhm.
But in the urban population or in all metros, prostate cancer is the second most diagnosed malignancy. So don't think that someone from North India is less prone to cancer, or somebody from South India is more prone, West or East. We as Indians need to follow this screening program, irrespective of where we are in India.
So maybe the metropolitans just have more awareness, and hence that's why
Yes,
there's
probably.
more of
Yes.
and screening.
Yeah, so it's not that prostate cancer is not there in rural India. It's just that they're not coming up to the hospital, so we don't have enough diagnosis. If we can penetrate everywhere in our country, this number is going to be huge.
And also possibly because initial stages, sometimes symptoms are not there, so people don't even
Yeah,
get
symptoms are not there. There is a tendency that when I don't have any symptoms, why do I do these tests and why do I spend money? It's not about money also. It's a very cheap test. Secondly, awareness is not there. There's a mindset that we need to change, that, okay, if I don't have any symptoms, I'll not get any checkups done. Please do your health checkups from the age of 35. You might not find any cancer in your body. You might find some heart disease, diabetes, hypertension. All these are major diseases which will affect you in the long run. So start off with your general health checkups at least, and make PSA a part of it.
Sure.
Okay.
Okay, I think we have 5 minutes over time. Raghu, any other questions? Otherwise,
No, that's it. I think I saw one question, maybe either to Kanal Ayappa or Dr. Ravi. Are there support groups? Are there support groups within the foundation or anything that you are aware of in case someone wants to join?
so basically support groups like for the patient or the caregivers.
For the patient or caregivers.
Once people get to know they have cancer, the instant reactions are quite extreme. So are there any kind of support groups which can provide?
As such, as of now, we don't have any support group. People, if you want to join us, we welcome them to help us out. And as Dr. Ravi brought out, the screening, the penetration has not gone to rural areas. That's where we want to move into rural areas for awareness and also for screening. And the general question asked is, I'm feeling fine, I don't have any symptoms, why should I be going for tests? Why should I be screened? Then we'll have to tell them, this is not the thing. I also didn't have any symptoms, but I had it. So we have to convince people to undertake these tests and screenings so that we can avoid them suffering at a later date.
Absolutely. Very, very valid point and good advice, Kanal. Thank you so much, Dr. Ravi and Kanal Ayappa, for a very informative session. Very, very useful. I hope people take the message in terms of getting screened early and getting screened regularly to detect early, so that there is very high chances of normal life right after that. Thank you so much. Really appreciate everyone joining. Thank you.
Thank you, everyone. And like I mentioned, the recording of this session is going to be put up on our YouTube channel. We have people who've also been watching it on our Facebook live streaming. So we hope that the session can also keep building awareness amongst more people as they view it on our social media handles. Thank you, everyone.
Thank you.
Thank you.
Thank you so much.
Thank
Wish you no cancers to come across.
Thank you. Thank you, Dr. Ravi. Thank you for your
Thank
time.
you.
Thank you.